Hi, I'm Tom Synan. I am the police chief for the village in Newtown, and I am also a co-chair for the Hamilton County Addiction Response Coalition. I've been the police chief here in Newtown for 20, going on 28 years. I got involved in the addiction crisis after I seen an entire family here in Newtown die from addiction, the mother and all three of her sons. So that led me to help form the Hamilton County, what we called the Hamilton County Heroin Coalition, which was group members from the community, everything from prevention, treatment, interdiction to law enforcement, fire EMS side, and harm reduction, working closely with public health, especially Hamilton County Public Health. And that started in 2015 with about 9 members. We have about over 100 members with over 40 different agencies, and about now close to 12 to 15 people that sit on the steering committee. Everyone's represented from the minority community to religious to business. It has really progressed in the past 6 years. When you build a coalition and you say, wait a minute, I in law enforcement interact with the same people you do. If you knew what I did and I know what you did, then we could share that information and it'd be provide a better service for people out on the street. We'd reach our goals. If another police chief came in and asked me why would I be interested in Cordata, I would tell them that it allows you to connect you to other services. We in law enforcement aren't the answer to resolve addiction. It is a chronic mental medical health condition. So we don't have the tools and knowledge and resource to do it. So if you have a system like Cordata, what it does, it brings all the resources into one system. So now you're able to communicate with other systems, and what you're really doing is you're building a coalition off of actionable data. So even if you're all not sitting at the table talking to each other, because you're sharing that information, because you're sharing that data, because you have access to certain information, and it can be filtered in different ways, they know that you're connected to the system. And from a police chief side, from a law enforcement side, now I can now communicate with my quick response teams, my law enforcement diversion, my court programs, with hospital systems. What you did is you built a system, so you as law enforcement, if someone's not going into the jail system, if someone is just overdosed and you brought them back, you know they can get into this continuum care model system, this collaboration, and you can then follow all the way through the progress. And if someone falls out of the system, you know where they fell out, you can put them right back in. So it's a good way to really communicate among systems, and for me, that's one of the pros with Cordata.